Hello, and welcome to the third episode of Healthy Baat. This is an initiative of the Essex Indians Charity, a registered charity working for the holistic well being amongst the Indian diaspora and the larger British Asian communities. Founded by like minded Indian expats more than a decade ago, today Essex Indian benefits from having more than 200 members. Our core mission is to create a sense of belonging among second generation British Indians to both the British and Indian culture that they belong to. Throughout the year, EI celebrates cultural festivals like Holi, Saraswati Puja, Durga Puja, and where people gather and celebrate as they would do at home. At the same time, we hold our Food and Folk Festival. Incidentally, that's on the 7th of June, where community participates together. Our community outreach programs focus both on physical and mental health through regular health checkups, badminton clubs, walking clubs, etc. It is an extension of EI's focus on community health and well being that we have initiated Healthy Bath, a series of conversations with physicians and subject matter experts answering health related questions sent by people across the community. I'm your host, Meghna, a public health and development professional for nearly 2 decades. And tonight I'm in conversation about menopause with Dr. Nandini Gupta. She is a consultant gynecologist. So let's welcome Dr. Gupta. Hello, Dr. Gupta.
Thank you, Meghna.
So Dr. Gupta will be answering questions on menopause. Now, this is, of course, one of those topics that we have heard about, we know of, but we don't really talk about it. It's still such a taboo for women, specifically women above a certain age. While we were discussing, while we were promoting this specific episode today, we received a lot of queries. Most of these queries are, I think I will share with them, share with you today one by one as questions. Shall we start with something very easy, actually? What is menopause?
So, generally, menopause relates to a woman who's finished her reproductive period and hasn't had a period for 12 months. So, to diagnose menopause, a woman period should have stopped for a year. But it doesn't mean the symptoms only start once, a year has lapsed without a period. Symptoms of menopause, perimenopause often start 2 to 3 years before the periods actually stop. So it's important for women in their 40s, mid 40s to be aware of what are the symptoms of perimenopause, menopause, because knowledge is power. And then we realize that there is a reason for these symptoms and it's just not in our head. So it's very important to get this knowledge out. And most workplaces are now have a menopause champion, and they are championing women who are 50 plus undergoing these symptoms.
So, starting with the other question that I received, and we've some of these questions might overlap a bit.
Not a problem.
Yeah,
I'm
so
sure you go on.
yeah, so the question is, can diet and exercise significantly influence the severity of perimenopausal symptoms, or is it a medical intervention usually necessary?
So to a certain extent, um, diet can help because say late 40s, our ovaries start producing less estrogen. So we might still be having periods, but we may start getting the menopausal symptoms of hot flushes, night sweats, mood swings, body aches, joint pains, the week before the periods, because that is when the hormones really dip. So we may not want to start HRT yet. That's fine, or hormone replacement therapy yet. So we can supplement our estrogen levels through natural sources. An important natural source of estrogen is soya bean. So we can have tofu. In Indian cooking, Nutri Nugget, it'll take you back to your days in India. Any kind of soya or chickpeas, chola bhatura. I'm not saying the fried bhatura, but take the chola and chickpeas, they're high in phytoestrogen or plant-based estrogen. So we can start supplementing and a high protein diet, less fat, less processed food, and exercise makes us feel good because any form of exercise, even if it is 15 minutes a day, releases endorphins and it gives us a sense of achievement, and that is mood uplifting. If we exercise with a group of friends or colleagues, that's even better because it's a social contact which helps in improving the mood. All of us start getting a little bit of dip in our general mood level before periods and approaching menopause.
Yes, I know what you mean. Uh, there was another question which is very similar. Um, how do I know if someone's perimenopausal? Because
Yeah.
menopause, I can understand, as you said, that it means that you've been without a period for a year. But how do I know if I'm perimenopausal?
So you will know because you suddenly realize that everything becomes a struggle. Getting up in the morning, you feel stiffness, backache. You just don't want to get up. You know you have to get ready, go to work, fatigue. So these are the subtle, when you're running up the steps, suddenly your knee joint starts hurting, muscle aches, you wake up with a cramp, or you start feeling hot and you want the fan on you at work, or you want to leave the window open when everyone's saying they're feeling cold. These are the subtle signs to be aware that possibly perimenopause is setting in.
Speaking of body heating up, there's this very viral video that went around on Instagram and Facebook for a while. It was this woman whose head was literally smoking, and in the sense that she was letting off steam on a very cold day, and that is how hot she was. And I think that is a symptom that a lot of people have mentioned, that they have hot flushes. What do you do when you have hot flushes like that?
Yeah, you can get hot flashes. So, you just, you'll find a lot of women carry neck fans.
Ah, yeah.
Leave the window open at night. Wear cotton clothes. Don't have too much of caffeinated drinks. Uh, Try and wear loose clothes. But if you need HRT, there's nothing wrong with taking HRT for your symptoms because it improves. The most important function is, apart from these physical symptoms of night sweats, irritability, waking up multiple times in the night, is brain fog.
Yes.
Now, perimenopausal, late 40s, mid 45, early 50s, we are at the height of our careers. We are often in meetings which involve us thinking on our feet, being spontaneous, being empathetic to people, being calm when things are not going your way. And we suddenly get brain fog and we know the answer, but we can't put the words together. So this is where, taking the help of HRT, seeing if it helps you is important. Having an open mind towards HRT.
Well, you bring up HRT, and I think I got one question which was very um, related to HRT. Is there any correlation with taking HRT and breast cancer, um,
So let
including
me
any
start.
other cancers?
Okay, so let me just explain the principles of HRT. So, what is the hormone that is going down as our ovaries stop working? It's estrogen. We need that estrogen to feel the energy for our skin, for our hair, for a youthful appearance, for the energy, for the zest of living. We do need estrogen. And that is the hormone which is going down, which is causing this brain fog, joint pain, um, the general feeling of I've lost myself somewhere in this process. So, the hormone we need for those whom diet exercise has not been enough, not everyone will get these symptoms, is estrogen. If the lady has had a hysterectomy, she no longer has the uterus, we can give estrogen on its own. We can give it via tablets, via cream, a patch, or a spray. For vaginal symptoms like vaginal dryness, painful intercourse, we can just give vaginal estrogen. So if you've had a hysterectomy, HRT is win-win because estrogen doesn't cause the increased risk of breast cancer. So what causes it is another hormone called progesterone that we need to give with estrogen. Because if you give estrogen alone to women who still have the uterus, unopposed estrogen causes thickening of the lining of the womb and, if left unchecked, cancer of the lining of the womb. So we need to add the progesterone hormone. So adding the progesterone hormone, if you take it for hormone replacement therapy of estrogen and progesterone, if you take it for up to 3 years, there is no increased risk of breast cancer. On a general population, not someone who has a genetic predisposition to breast cancer. I leave
Mm.
aside who carries a specific genetic marker called the BRCA gene.
Yes.
So, but if you take HRT for longer than 5 years, there is a slight increase in breast cancer. That increase is 4 new cases in 1,000 women, HRT related. So what we would suggest is take a trial of HRT, take it for 3 years, see if it works and gets you over the hump where the symptoms are most difficult. And if you don't need it, don't take it beyond 3 years. If reevaluate the situation after 3 years. If you need to take it for 5 years, take it for quality of life. And just be aware that the increased risk is 4 per thousand. Once you stop it, the risk starts reducing. You go back to your general risk. It takes about 10 years to go back to your usual risk. And there are different ways of taking the estrogen progesterone. If you take in the first year of menopause, if your periods have not stopped for more than a year, you have to take the estrogen patch, spray, or tablet throughout. And the last 2 weeks, you take the progesterone and you get a withdrawal bleeding or a period every month. So, that formulation where you're taking the progesterone tablets only for 2 weeks out of the whole month has a less risk of breast cancer. After a year, if you don't want to have periods, you can have estrogen and progesterone throughout the cycle. That leads to a slightly higher risk. There was a study in Lancet in 2009 which suggested the lowest risk was estrogen alone. Slightly higher risk is if you're taking the progesterone for 2 weeks in a month and having a period every month. And the slightly more risk was if you take it throughout and have a no bleed preparation. Sorry, it's a lot of medical knowledge, but I'm
No, no,
happy
yeah,
to follow up questions. Does it make sense?
that makes sense. I think um, instead of putting a very blanket approach to it, saying that HRT, if you take HRT, you will, the chances of breast cancer rises. It says that if you have progesterone and estrogen and you have a balancing it, so I think that gives it it's a sense of completion as to what you're supposed to do. It's not just it's HRT is such a blanket term for most of us, so that really
The
helps, I think.
beauty So the beauty of HRT, even more than symptom control, is it protects our bones from osteoporosis or bone thinning, which is the bane of our existence of elderly women. Most of us have mothers, aunts who've had a fractured hip, fractured neck, femur, have very active people have ended up bedridden sadly. So if you take HRT for prevention of bone thinning or osteoporosis, we suggest take it straight away. Take it below the age of 60, take it for 5 years. After the age of 60, no point taking HRT for bone protection. Take it when you have that dip in estrogen and progesterone and supplement it with a high protein diet and vitamin D and exercise. Maintain your muscles and your joints in their best condition.
So that leads me to another question, though. If I'm coming into menopause, say in my 40s or my 50s, and I'm a little on the overweight side, or maybe on the obese side, if I'm bigger, does losing the weight help me get into menopause fitter, or does it help me to delay it?
It won't delay it because we all have a fixed number of eggs in our ovaries. If you started your periods early, your menopause will be early. If your mom
Oh,
had menopause early 40s, more likely you will have early 40s. If you started your periods later, you will have still more eggs and they'll possibly carry on. But it's important to manage our weights, because during menopause, all of perimenopause, we'll all put on weight because our metabolism slows down. With our mood swings or slightly low mood, we will develop cravings, and we will want the feeling that, high sugary processed food brings.
Mm.
Like when I'm a little bit tired, whenever I'm an obstetrician and gynecologist, so when I'm on my labor ward hot week, which I have to work 8 to 6 for 5 days in a row, I'm constantly eating, because if I don't keep my blood sugar at a high level, I won't be able to cope with whatever everyone around me is throwing at me with a smile. Because if my blood sugar drops,
Yeah.
I will not have the ability to keep calm. So, similarly with menopause, if you're feeling up, down, tearful, we will, gravitate towards chocolate or ice cream, or, a bag of crisps. So, it's important we approach menopause as fit as we can. Also, if you're overweight and taking HRT, it increases our risk of breast cancer,
Oh dear. All
because
right.
after menopause, an alcohol intake and overweight increases risk of breast cancer, because after menopause, the ovaries are not producing estrogen, but our ovaries will continue to produce androgen, or the male hormone testosterone. That gets converted in our belly fat into estrogen. So, overweight women, uh, in a way, have better skin because they're still producing their estrogen. But they're also at higher risk of cancer of the lining of the womb, endometrial cancer, because of that unopposed estrogen. They're no longer producing progesterone. Progesterone is produced only when we release an egg or ovulate. So, if you're overweight, we are at high risk of endometrial cancer. So, on top of that, we are taking HRT. So that increases the risk of breast cancer if a lady is overweight. So it's easy to say lose weight, but it's important to get with early 40s.
Right. So, okay, I think the gloom just set on me for a bit, but
It's in your
so
hand. It's in
so
your hand.
it's in my hand, obviously. But then, in fact, that brings me to another question that is quite related, and that is, and I'm paraphrasing. I have always maintained a consistent routine of exercise 4 days a week, followed a healthy diet plan. I was able to lose 2 or 3 kilos per month when targeting weight loss. However, this year, as I approach 40, the same routine no longer yields the same result. Could this change in my body be related to perimenopause?
I would say that is unlikely to be perimenopause unless you're having symptoms that your periods are becoming irregular, you're getting hot flushes. It could be that your metabolism is slowing down, which happens to men as well as we grow older. So often, then it's better to have weight training sessions, because that increases the metabolism. Focus on a protein rich diet with less carb, lower carb diet.
Um, will HRT also help in controlling the weight gain?
It won't help you in controlling the weight gain, but if your mood is better, not
Mm,
getting the mood swings, it might curb the hunger, for chocolates or whatever we reach to when we are feeling a little bit down. Because
yeah.
when we're feeling exhausted, at least if I can speak for myself, when I'm feeling, I don't like sweets. But when I'm feeling tired and there's work to do, I will put 2 spoons of sugar in my tea, and I will reach out to my weakness is ice cream, and I will reach out to ice cream. So when we are all a little bit low, that's when our diet goes out of the window. So with it, I'm not saying that HRT is the best thing. It has to be individualized.
Yeah.
If you're feeling that you're losing yourself as you're growing older, late 40s, 50s should be a good time in our lives, because we are settled in a career, financially secured, we don't have to stay up nights with young kids. This is really our time to reclaim our time. So it's worth giving it a go.
So again, with the HRT, I got some questions on the HRT itself. One was, will it help in the lack of sleep, joint aches, mood swings is something that we already discussed, hair loss.
Lack of
The
sleep, definitely it'll help in, especially the progesterone. We suggest take it at night. Progesterone is a calming hormone for all muscles. Like we say, it's a calming hormone for the womb, for our brains. It helps falling asleep and maintaining a sleep. So it'll help with the sleep, and you could supplement it. It's a bit controversial with collagen, capsules or powder and HRT. You might notice a difference in your hair, but a lot of it is conjecture. I'm not sure, how strong the research in it is. But I would take it.
is there any role that, say, one of my questions is regarding UTI and incontinence.
Yeah,
So, is there any relation to menopause? Would
of course,
menopausal women?
of course. In women who've had a vaginal delivery,
Mhm.
we're at high risk of having, incontinence with menopause, especially
Oh,
stress incontinence. That's when we cough, when we exercise, when we jump on a trampoline. Because we need estrogen is the best thing for the vaginal skin. As that estrogen is dipping, that skin becomes atrophic and dry. So, if the symptoms are mainly incontinence related or dryness in the vagina or pain with intercourse, you don't have to take the oral or patch HRT and the progesterone and increase the breast cancer risk after 5 years. We can just try vaginal estrogen, which is not absorbed. So, you can try, but it has to be prescribed by the GP or a gynae consultant, and you can just try little bit of estrogen through an applicator in the vagina every night. Give it 6 weeks and you'll see the difference. We initially start with, twice. You can take it every day for a week, then we would maintain it for, twice a week for a few weeks and review. And very minimal is absorbed, so it doesn't affect the lining of the womb and you don't need to give progesterone. But it has to be reviewed and prescribed by your GP or by the gynae consultant.
are there any side effects to taking HRT apart from, for example, the breast cancer, which is it's just an upping of risk? But are there any other
Sometimes
side effects?
risk of clots, rarely, but everything adds up. If you're a smoker, if you're overweight, everything adds up.
And how long before you start showing results of taking an HRT? Of course, I understand that it is how you take the HRT as well,
Everyone
whether
is
you're
different.
using, yeah. All
Everyone
right.
is different, but I would
Yeah.
say 2 or 3 months. By 3 months, you should see a result. Maybe even in 2 months' time. But the initial month, there's a placebo effect. Just if we start doing something for ourselves, we start believing, that something's happening, but everyone is different.
Uh, we were talking about sleep patterns, and someone asked me that they find themselves waking up every night at 3 o'clock, like 3 a.m., and otherwise having difficulties going back to sleep or just having random thoughts coming into their head at night. Um, and she was also wondering if this is a symptom of menopause or perimenopause.
So it depends on the age. First of all, it depends on how our day has been. Have we been in a high stress situation? We are high in adrenaline. Are we looking at Facebook or WhatsApp before we go to bed? Because the light from the phone, it's not good for. Have you had a fight with someone? All these affect our sleep quality. But if we can be disciplined and say no internet, no phone, laptop for an hour before we go to bed, and just get into this ritual of winding down, maybe take a bath at night. Things to help wind down, that can help. But menopause definitely leads to waking up in the middle of the night. And that can, if that person is menopausal, and if these initial non hormonal methods have not worked, it's certainly worth trying to see if HRT, especially the progesterone, can help. It's individualized, we are all unique. So one size will not fit all, but it's worth trying. HRT is not poison, it's worth trying.
Um, so, another thing that, well, I have noticed that as I'm getting older, and a lot of women around my age or, in their 40s, they have reverted to bad skin like they had when they were in their teens. And of course, there is now a big market, industry which is selling potions and lotions for us. Do you think that this is linked to menopause, the skin, breakouts and
It can be because, like I said, our ovaries stop producing estrogen, which is producing the male hormone androgen. That is not all bad because to maintain libido or interest for intercourse, we need a little bit of the male hormone. But
yeah?
if that male hormone, if it's getting higher than the estrogen in our body, can cause breakout.
And I think the cosmetic companies have, got in the right market, because there are a lot of serums and potions marketed towards, I think, menopausal, perimenopausal women and their breakouts. And um, at
But
this point of time, a lot of people will,
hormonal. I don't think those creams help. It's really hormonal. The only thing is, if you do a good skin routine, if you invest in yourself, if you give yourself attention, you start feeling good. We end up prioritizing family, work, a clean house, everything, and we come last. So it's almost about, making yourself a priority. So if you want to invest in a cream, I don't know how much the cream helps, but the fact that you're spending money and time on yourself will improve your mood. We need to prioritize ourselves.
I think those are wonderful. That's a wonderful way of looking at it. And, a lot of why I think it was very important for us to do this conversation is not just for women, but for the men that live with us as well.
Of course,
And because
it's for
we
them
are,
mental health.
yeah, because our mental health during this time is 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 I don't know, I don't know what the right word is. Every day is a different kind of struggle, and people around us don't know how to deal with it. And again, we don't come with a booklet or a pamphlet.
Yeah, but it's important that people around us are just kind to us. But it's also important if we behave badly with family members because, that's our safe space. We have
Yeah.
to be calm, polite, respectful at work. Even with children, you have to be very careful on how you talk to them. Otherwise, it becomes bullying or they tell you you've spoken too loudly, we are interrupting them. So it's like we learn, and especially if you've grown up with your initial years in India culturally, we are very passionate, we are loud, we are engaged, we interrupt each other, we are impatient. But the Western culture is about more respectful and patient conversations. And it's almost something we need to learn from our children. So we can't be even ourselves with them. So the only person that we are ourselves with is if we have a healthy relationship with our husband, is we are at our worst with them because we expect that they have to understand everything. But it's important that we tell them that this is what I'm going through. So if my behavior has upset you, do let me know. And I will take it on board, reflect, and I will try. And I do apologize. Similarly, once we have a baby, there is really something very little known about postnatal depression. If I just share a personal story, my daughter is going to be 23 this year. And during my pregnancy, I lost my mother as well. And I was in like severe grief throughout the pregnancy and postnatal period. But I just didn't understand it, like why I was just so upset with everyone. I was just upset all the time. So next time round, when I had my son, who's now 15, I told my daughter, I told my husband, day 14, up till day 14, I'm going to get postnatal depression. I'm going to get postnatal blues. Don't get upset. If I start tidying the house, and then even at 4 weeks, 6 weeks, I was behaving in this strange manner. At 6 o'clock, I'd want the house to be clean. Everyone, husband, daughter, au pair, everyone used to hide. And then my daughter said, Mom, this is too long. It's post 6 weeks. How long is this going to continue? But at least there was an end point, and I warned everyone this is what I'm going to become in the postnatal period. But with menopause, you see, there is no end. So we have to tell our husbands that there is no end to this. Just bear with us and hold our hands through this journey. It is as confusing and scary for us as it is when you see us change before your eyes. Just treat us with empathy and compassion and unlimited love.
Yeah. I think somewhere the mental health struggles of menopause, has been so downplayed over the years, or maybe not even identified. So we didn't understand that our mothers or grandmothers were going through menopause, and if they were a little short with us, it is because they can't help it. A hormone is changed. It's the hormones that's making them act that way. That was not something we talked about.
But Meghna, my MD thesis from Calcutta Medical College, Eden Hospital, was on menopause and HRT. And how old was I then? Whatever. I think, but my mother-in-law, she used to tell me about hot flushes. She was my first patient. I started her on HRT, and she's a very educated and vocal lady, and she tell me, oh, hot flushes, this is happening, that is happening. And I was this great passionate believer in HRT because that was my MD thesis. But I think they used to talk amongst themselves and amongst women, but maybe they didn't say it openly. But now menopause is no longer a taboo. At work, the secretary says, oh, I'm hot flushes, I'm menopause. Like
Right.
premenstrual tension or mood swings before the period, everyone acknowledges it. Oh, I'm getting PMT. You know, have you heard of mood swings before periods?
Yeah.
Like the week before periods, can feel angry, can feel weepy, can feel suicidal. So you're very lucky if you haven't experienced it. Lot of women do experience it. So this again, when my patients come, I do pediatric gynae as well. The mothers come and tell me PMT, there's menopause, or there's pelvic pain, endometriosis. The women are very knowledgeable now, and I think finally, women's health was always shameful.
Yeah.
It's like, especially in our society, you couldn't tell anyone that you were on your period. If you didn't enter the temple, people kind of knew. We were ashamed of going out and buying sanitary napkins. But why? It's a normal physiological function. So that taboo, at least in the Western world, is gone. But maybe
I
it's
think it's
gone amongst the
yeah.
young. We just have to catch up.
I think it's definitely times are changing. I think especially with period health, period understanding, um, we've really gone far, and it's the menopausal health. I think people are also coming up to chapter on that. So um, it can only get better.
Yeah, and not only menopausal health, don't be embarrassed if you have a gynae issue, if you're getting
Yeah.
pain periods, if you're getting pain during intercourse. You don't have to be silent, and it doesn't mean that there's something wrong with you or you're abnormal. Just talk about it. Contact your GP, um, ask for a referral, or try and read it up. Look up NHS website. You have to be your own advocate because no one else will be. Find your voice.
The Well, another question that I just got was on pap smear. I think every 3 years, women above a certain age, we are supposed to
Oh,
get
the
pap
age is
smears.
specified.
3 to 5 years. When you're menopausal, does the gap reduce? Do we need to get it more?
No. So from the age in England, from the age of 25 to 50, it's every 3 years, and between 50 to the age of 65, it's 5 years.
So it increases.
The gap is more.
The gap is more. Would that? Why is that? Does that mean that I'm then less of a threat to get cervical cancer?
It's it's usually found that women who are susceptible to HPV virus,
Yeah.
we haven't been vaccinated. Our children have been. They've had the
Yeah.
3 doses when they were in school, but in spite of that, you can still get HPV and cervical cancer. So usually the prevalence of HPV comes through intercourse. It is not a sexually transmitted infection like chlamydia or gonorrhea. If you test positive for HPV, doesn't mean that your husband has had an affair or you've had an affair.
Right.
It has come through intercourse. So unless the two partners were virgin, no one has had any sexual contact, most women will be exposed to HPV. But it lies dormant in our system. So if we've had HPV, say at the age of 26 or 18 or whenever, but when our immunity goes down, that HPV can flare up. Or if you have a new partner, new relationship, you can get HPV. So with any screening, there it is about cost effectiveness. So it's targeted towards a population where we are most likely to find HPV.
Right. So when you're more sexually active,
Yeah, not that you're promiscuous or whatever, but
just sexually active. Yeah.
especially yeah,
So again, when we're talking about being sexually active, I think menopause is also I won't say a deterrent, but it's been thought that menopause is a
maybe
deterrent to being sexually active.
because if intercourse is painful, um, if the vagina is lacking estrogen, if we lack libido because the testosterone level's gone down, of course it is a deterrent. But HRT can help with that, especially vaginal estrogen can help with the pain with intercourse, discomfort with intercourse. And there are testosterone patches or the male hormone patches which can do wonders for the libido. Even men go through a dip in their hormones and it affects them as well. But there is even less discussion about the symptoms men go through because they haven't, they, you almost have to be confident and there has to be a certain amount of self belief to come and talk to your GP or a doctor to say, this is what I'm experiencing. So, at least we women, we have been able to find that. But even men often go through it silently. It can have an effect on mental health of men. And that is not an area that men are able to open up to as easily as us.
I think somewhere around the way, women have this unspoken support system from other women also, um, and especially women of a certain age, uh, and and that helps
Yeah,
because I think as you were saying that back in India or say our grandmothers, maybe they were not telling us about their menopausal symptoms, but they were definitely talking to their friends and other women
yeah.
nearing their age. And I don't know how many men are comfortable talking.
They often don't open up to even to each other because they think it's, I shouldn't generalize, but often with men, society expect them to be strong, to be confident. These are things that we've imposed on men, which makes it even more difficult for them to ask for help. It makes it difficult for everyone. So like we are saying, treat women with compassion, and I think the same goes for us to be more understanding of our partners when we are not low on a mood swing.
Okay, so I have a how do I put it? An interesting set of questions for you. What are the myths that you have heard about menopause?
You know, I
You know,
haven't I haven't heard any myths. Orpita will tell you, I'm a bit of a hermit. I either work or I come home and I look after my elderly father who's 98 and a half with Parkinson's. So there is hardly any time for me to interact with people
There,
to come across
yes.
myths. You give me a myth, I'll discuss it.
So one of the myths that I've heard about menopause is that um, A was, I think, something that we discussed earlier. The quicker you start your period, the quicker you will start menopause,
That can
and
happen because it's
that
related
that
to
can
me.
happen. So that is not a myth.
It can
Uh,
happen.
that can happen. Um, the second thing that I've heard, that if you're not, if you're not sexually active for a while, then you can start menopause quicker.
No, that should be. You might have the symptoms of vaginal dryness and everything, or you might worry about it more, but
That's also a myth.
that would be a myth.
Ah,
There's no
so
scientific basis to start it.
because yeah, because one of the things that I was doing was I was googling a lot when I was looking up menopause, and these were things that people were actually discussing on
Internet.
online chats.
But what
So
does it matter? Whether if it happens, we deal with it.
right, and of course, one of the ways is through HRT, which is the medical intervention. There's
HR
another question.
or diet with
Or
people.
diet. So there is another question that came up from one of our viewers, and that was on something that you had suggested was soya as a source of protein when you are a vegetarian. And she said that she has restricted soya intake due to thyroid issue. Is there any substitute for that?
Chickpeas, she'd have to check. I
Chickpeas.
don't know the specific interaction between thyroid and soya. She'd have to check that.
Right. So,
Chickpeas are
yeah.
good source of natural estrogen.
Are Indian women more, is our menopausal age earlier?
Not necessarily. Average age of menopause in UK is 51. It varies on the family. It shouldn't be earlier. I have seen a lot of women from India who are not menopausal even at 55.
So it has a lot to do with your reproductive health in
Yeah.
general.
And women who've had children later in their 40s, often their menopause is later.
Ah, okay.
It's good to have children a little bit in early 40s. It's not a bad thing for us.
There's another question that, when we were doing our session on IVF, so if a person is menopausal, proper menopausal, but they had their eggs harvested, taken out, and frozen, could they still carry a child? As in, could they still get pregnant?
Yeah, because women who are having chemotherapy or who often we store the eggs. Orpita will be an expert IVF related, but they can carry a pregnancy with the hormone support. But IVF is not my area of
All
expertise.
right, of course, we'll
Yeah,
come back to that with Orpita.
and
The
if women have become menopausal, they can use donor eggs,
Yeah.
and IVF centers will, you can have a friend, a sister who's willing to donate eggs for you, or they can find someone. There used to be a scheme in some IVF centers that if you had good quality eggs, you could share your eggs and give them to another woman who has ovarian failure or poor eggs, and they pay for part of your treatment. And egg donation helps women with premature ovarian failure, cancer survivors. So it's a fantastic thing to do. But it's more invasive than sperm donation because your body will need
Yeah.
injections, you'll have to produce more eggs, then those eggs will have to be retrieved with and so it's more intrusive. But Orpita is the person to ask about this, not me.
Yeah, I think one of the things that she's also just said is egg donation is an option for women above 43 years.
Yeah.
And having children in early 40 years lowers chances of having a healthy baby.
So
So,
we see that there are risks of Down
mm,
syndrome, etc., but it's not an absolute no-no.
yeah,
The risk of miscarriage increases above the age of
yeah.
40. The average risk of miscarriage for women is about 25% of any pregnancy. 20. This risk increases to 50% for pregnancies above 40. Pregnancies above 45, risk of miscarriage is 90%. So there is higher risk of chromosomal problems, but it's not an absolute no. It's if you get pregnant at 40, it's not a disaster. I'm not saying plan your first pregnancy over 40, but it's not a problem. Lot of
People have kids all the time. I think, yeah, I think
the
we've,
one must be practical. The older you have, it's a higher risk pregnancy, risk of having smaller babies. Mm, So there are more risk and risk of higher risk of Down syndrome, certainly higher risk of miscarriage.
so just to, I think, wrap up our discussion for today. Um, Someone looking at menopause in the next year or two, as you said, we can't really plan it, but someone staring at the face of menopause, literally, how do I prepare myself? How would I, how would I go about making myself in the right state of body and mind and health to approach menopause?
With an open mind. Start each day and start this new phase in your life with hope. It may not be doom and gloom for you. Everyone is different.
Yeah.
If you have a supportive work environment, understanding work environment, and understanding work environment is not magic. We have to, do our work, be kind to people. We have to build those relationships so that when we are down, vulnerable, there are people to support us. A supportive family unit. You may not need anything. But in spite of all this, you may need HRT or you may need counseling for depression. Just have an open mind. Don't have any fixed ideas. And just just embrace this new phase of life and succeed in whatever you want to do. This is your time to shine and flourish.
Thank you. I think this is the most optimistic I have heard menopause being described as. And, sometimes when you read about it or go through these information, it is quite doom and gloom. But the way you put it, that these are the glorious years of your life coming up when you have settled everything else. So look forward to it and see what life throws at you.
Yeah, and make the most of each day.
Yeah.
Just make the most of each day. For some people, menopause is a blessing. If you have severe PMT or you get these mood swings, you start getting angry before periods, that goes. You
Oh,
might become more balanced and calm. You may not get angry with people. You may be more considerate. At least with me, I know I used to be very fiery when I was younger. Honestly, as I've grown older, it's been a blessing because I've just stopped getting angry with
okay.
everyone,
So
apart from my
I
husband.
think that's a good thing.
I
So we
think
have another good thing.
joys of getting older, embrace it.
Absolutely. Thank you so much, Dr. Gupta. I think it's been one of the most positive discussions that I've ever had in my life about something that is impending. But thank you so much. I think we've answered most of our questions. People who are sending me questions now, you would have to wait for the next session. Um, and we shall meet again with another set of questions. Thank you, Dr. Gupta, so
I
much.
have a last message for Orpita. I saw
Okay.
her discussion, wonderful discussion. Above 50 is new 30. No, Orpita. above 50 is better than our 30s. Thank you.
Oh, yeah. I hated my 30s. Yeah, 50s is good. Thank you.
Wonderful. Thank you for giving me an opportunity to have a chat. I really enjoyed it.
Thank you so much, Dr. Gupta. Take
Call
care.
me Nandini and have a wonderful evening. Good night.
Bye.